Hello viewers, I received a great response to my video about the human spine, so I decided to continue making more videos on human anatomy, especially because anatomy is such an important topic for MRCS Part A. Now let me ask you a question, viewers. How important is your hand to you? As with other things that we tend to take for granted, the importance of a hand is also something we only realize once it stops functioning properly. So many expressions illustrate the importance of the hand. He was his right-hand man, meaning he was the chief assistant to a person. Or the Hindi expression baएं हाथ का खेल, indicating how easy a task must be, seemingly. Fun fact, as per Wikipedia, only 10% people are believed to be left-handed. From making the famous heart sign of BTS fame, to rubbing fingers together to indicate how wealthy members of BTS must be, to lifting weights, to understanding how hot that thing you should not be touching really is, our hands are extremely useful to us. But what ensures that the hand functions properly? Is it the bones that provide structure, the muscles that help in movement? Maybe. In my opinion, however, the key to the puzzle are the nerves. Now, I've been using the word hand quite loosely here. The anatomically accurate word would be upper limb, or the more fancy superior extremity. Hand actually is only the part of the superior extremity from the tip of the fingers to the wrist. From the wrist to the elbow is the forearm or antebrachium. From the elbow to the shoulder is the arm or the brachium. All the nerves responsible for proper functioning of the upper limb originate in the spinal cord in the form of a plexus, which is appropriately termed brachial plexus. That is what we will discuss in today's video. The moment we hear the word brachial plexus, we imagine a highly complicated structure with so many things to remember. My objective in this video is to provide information that is easy for you to remember and easy for you to utilize in your exams or tests. This is not a deep dive video. With that out of the way, brachial plexus is responsible for both sensory function and motor functions of the upper limb, as well as parts of the upper back. Brachial plexus, as previously stated, originates from the spinal cord. Spinal cord itself lies in the spinal canal, which is a cavity inside the human spine. Spinal nerves come out of the spinal cords between each of the 33 vertebrae present in the human spine. In the neck or cervical region, spinal nerves are named after the vertebrae lying below it from C1 to C7. Fun fact, C1 vertebra is called Atlas and is named after a character from Greek mythology who was condemned to hold the weight of heaven on his shoulders after losing a war against Zeus and other Olympian gods. So Atlas, the first cervical vertebra, also supports the weight of the human skull. We would definitely not want this Atlas to shrug. There is a C8 spinal nerve but only 7 cervical vertebrae. So C8 is the nerve that arises from below C7 vertebra, and T1 spinal nerve is the one that arises between T1 and T2 thoracic vertebrae. It got confusing, didn't it? So to simplify, cervical spinal nerves are named after the vertebrae below the nerve, and thoracic spinal nerves are named after the vertebrae above the nerve. This naturally creates a difficulty in naming the nerve below 7 cervical vertebra and above first thoracic vertebra. So to ease the pain, this nerve is called C8 spinal nerve. Each spinal nerve gives out an anterior ramus or a ventral ramus and a posterior or a dorsal ramus. Anterior and ventral are just fancy medical jargon terms to describe the front, whereas posterior and dorsal are medical jargon terms to describe the back. So posterior rami are largely responsible for the back muscles. Anterior rami of C5, C6, C7, C8 and T1 participate mainly in the formation of the brachial plexus. So the main participants in the formation of brachial plexus are anterior rami of C5, C6, C7, C8 and T1. They pass from the neck below the clavicle or collarbone through the axilla or armpit to reach the upper limb. Along the way, they are described with 5 different names, which we need to remember and often find quite confusing. Now to remember, I want you to imagine a tree that drinks cold beer. Sounds absurd, I know. Trust me, if you can visualize a tree that drinks cold beer, you will never forget the sequence of the 5 words used to describe the different parts of the brachial plexus. So what comes first in the growth of a tree? Roots. What grows next in a tree? Trunks. Plants with roots and trunks are called trees. Please don't quote me in your botany exam. So the essential parts of trees, in my humble opinion, are roots and trunks. Now what does this tree in our example do? It drinks cold beer. So what do we have? Roots, trunks, drinks cold beer. Roots, trunks, drinks cold beer. Roots, trunks, divisions, cords and branches are the 5 words used to describe the brachial plexus from the spinal cord to the upper limb. One more time, brachial plexus has roots, trunks, divisions, cords and branches. Roots, we have already mentioned, are the anterior rami of C5, C6, C7, C8 and T1 spinal nerves. The upper 2 roots join together, C5 and C6, they join together to form an alliance called the upper trunk or the superior trunk. Lower 2 trunks C8 and T1 are not to be left behind, they join together to form the lower trunk or the inferior trunk. The middle root, that is C7, is left all alone. It continues alone as the middle trunk. Now each of these trunks guard their front and their back. So they have 2 divisions each, one anterior division and one posterior division. So we had 3 trunks which divide into forming 6 divisions, 3 anterior divisions and 3 posterior divisions. All 3 posterior divisions lie posteriorly and they join each other to form the posterior cord, which continues to lie behind or posterior to a major blood vessel, the axillary artery. The 3 anterior divisions are lying in front, they are exposed. The anterior division of the middle trunk unites with the one lying above. So anterior division of middle trunk and upper trunk join to form lateral cord which lies lateral to the axillary artery. The anterior division of the inferior trunk remains alone, tries to stay close to the midline and continues medial to the axillary artery as the medial cord. Just for the benefit of people who are not familiar with medical jargon, anything lying more towards the head is superior, the opposite is inferior. Anything lying more towards the midline of the human body is medial, the opposite is lateral. Of course, structures towards the midline are more protected than the ones lying more lateral. So now we understand what is the meaning of lateral, medial and posterior. So lateral, medial and posterior cords lie lateral, medial and posterior to the axillary artery. Finally, we have the branches. Branch is just a fancy word for nerves. Some nerves or branches arise directly from the roots, like the long thoracic nerve, which contains nerve roots C5, C6 and C7. So if someone asks what's the root value of long thoracic nerve, just say C5, C6 and C7. An easy way to remember which muscle is innervated by long thoracic nerve is a famous verse that I learned from the noted anatomist. Roses are red, violets are blue, and long thoracic nerve supplies serratus anterior muscle. Probably not helpful, but it made me laugh. So I will leave a picture at the end of the video describing the less important branches, but the most important branches shall be described in slightly more detail now. The really important branches or nerves arising from the brachial plexus are the 5 terminal branches: musculocutaneous nerve, median nerve, ulnar nerve, radial nerve, and axillary nerve. If you think about the arm, I believe the first muscle you are probably thinking of is the biceps muscle, more accurately known as the biceps brachii muscle, which is innervated or supplied by the musculocutaneous nerve, which is a branch of the lateral cord. Lateral cord, you know, is formed by the union of anterior divisions of upper and middle trunks. Upper trunk is formed by the union of C5 and C6 roots, and middle trunk was only C7 root. So root value of musculocutaneous nerve will be C5, C6 and C7. It's that simple. As the name suggests, musculocutaneous nerve supplies muscles with similar sounding names like biceps brachii, brachialis and coracobrachialis, and carries sensations from the skin of the lateral part of the forearm, that is the cutaneous in musculocutaneous. Median nerve is perhaps the most frequently asked question related to brachial plexus. Median means it lies in the midline. So naturally it is derived from both lateral and medial cords of the brachial plexus. Lateral cord roots we already know from musculocutaneous nerve. Medial cord is the continuation of the anterior division of inferior trunk, which was formed, remember, by the union of C8 and T1 roots. So what will be the root value of median nerve logically? It should be C5, C6, C7, C8 and T1. However, this is true in only some individuals. C5 usually does not contribute to median nerve formation. So root value of median nerve is C6 to T1. You can remember this as thinking median nerve wants to stay in the midline, so it has rejected the most outlying nerve, that is the most lateral nerve root, C5. Not everything needs to make sense, Details of median nerve function would be described in a different video as it is quite extensive. Ulnar nerve is a branch arising from the medial cord, so naturally its root value is C8 and T1. If we know anything about bones in the upper limb, we know that there are two bones in the forearm, radius and ulna. Ulnar nerve would lie close to the ulna and supplies many muscles. Again, details of ulnar nerve function deserves a dedicated video in the interest of keeping this video brief. If there is ulnar nerve, there must also be radial nerve, perhaps the most popular of all branches of the brachial plexus. Radial nerve is one of the two important branches of the posterior cord and largely lies in the posterior aspect of the upper limb. As posterior cord is formed by the union of posterior divisions of all three trunks, radial nerve would have a root value of C5, C6, C7, C8 and radial nerve has a long list of functions which I'll be happy to discuss in a separate video dedicated only to radial nerve. Finally, brachial plexus passes through the axilla or the armpit, so there must be a nerve bearing that name. Sure enough, there is an axillary nerve, which is the second branch from the posterior cord, but it only receives the root value of upper trunk as it branches in the, you guessed it, axilla itself. Hence the name axillary nerve. So root value of axillary nerve is C5 and C6 and not all the roots from C5 to T1 as it was in radial nerve. Axillary nerve is responsible for the function of the deltoid muscle and teres minor muscles. It also is responsible for skin sensation in the regiment badge area. Detailed description of the functions of upper limb controlled by the branches of brachial plexus would require separate videos. So I'll make a separate video on radial nerve, ulnar nerve, axillary nerve, musculocutaneous nerve and median nerve. So that's brachial plexus in a nutshell for you. Let me know which branch of the brachial plexus you want me to describe next. Thank you for watching this video. Take care, bye bye, and please don't forget to be awesome.